Welcome back to the Deep Dive. Today, we're cutting through quite a bit of legislative history. We're going to analyze a real cornerstone of worker protection, the Occupational Diseases in Mines and Works Act 78 of 1973. You'll often hear it called the ODMW Act. Now, for you, the listener, maybe you're prepping for a law exam, or perhaps you're just really curious about how these high-risk industries are regulated. Either way, this act is, well, it's crucial. It's a specialized consolidated law, and it's fundamentally shaped how worker health and compensation are managed, especially in sectors like mining. Our mission today, to really unpack it, get beyond just the text on the page. We want to reveal the framework, some of the administrative complexities, and, the evolving social impact of this law.
And evolving is definitely the right word. I mean, yes, it was assented to way back in 1973. It's over 50 years old now, but it's absolutely a living document. Our source material shows it's been under continuous review, continuous revision. We're seeing updates even recently, showing it's still functionally relevant today, governing the working lives of thousands.
Absolutely. And its core purpose is clear. Guarantee compensation for specific, pretty dangerous diseases people might contract, working in mines and related works. Okay, so let's start unpacking this legislative stack. First things first. What are the boundaries? What are we actually talking about when the Act says mines and works?
Right. Well, the definition of a mine is much broader than just the typical image, a deep hole in the ground. Legally, it covers the whole infrastructure involved in winning a mineral. So that includes the excavation itself, quarries, the mine dumps, and crucially, all those processing areas. Think places used for crushing, smelting, refining, or producing something of commercial value from the mineral.
Ah, okay. So if you're working on, say, a slimes dam, or maybe in a refinery right next to the main pit, you're still considered to be in the mine under this definition.
That's exactly right. It generally defines the entire operational perimeter as one single entity. It is interesting, though, that the law specifically excludes places making clay or cement.
Why might that be?
Well, it suggests a historical legislative distinction, possibly based on the perceived severity or maybe the type of dust exposure compared to mineral dusts found in other mines.
Okay, that makes sense. And then there's the other term, works. How does that fit in?
Works essentially captures operations that are separate from the mine itself, but are still involved in handling and treating the product. So think about dedicated facilities that crush stone or screen materials or treat minerals for, say, base metal production or refining precious metals. If that kind of activity defines the place and it's not a mine, then it's likely a works under the Act.
Got it. Now, looking back at the Act's history, you mentioned it's evolved. One of the biggest shifts, arguably, is the move away from race-based law.
Oh, absolutely. That's a fundamental thread running through its history. You have to remember, the original 1973 Act came into being during an era of, well, legally enforced discrimination, and that was reflected in its structure.
Right.
The real pivotal change came later, with the Occupational Diseases in Mines and Works Amendment Act 208 of 1993. That amendment systematically went through and repealed all those racially defined terms, black person, white person, colored person, and it got rid of the related authorities built around those categories.
So it wasn't just tidying up the language.
Not at all. It was more than a legal cleanup. It fundamentally redefined who was considered, worthy of protection under this specific law. It shifted the focus entirely to the occupational exposure itself, regardless of race.
A really vital turning point. And presumably that shift towards equality meant needing new administrative structures to handle claims fairly for everyone. So let's look at who exactly is tasked with running this updated system and, crucially, measuring the risk involved.
Okay. The administration side relies on several distinct bodies. You can sort of group them into medical oversight, financial management, and risk assessment. The medical engine, really, of the whole system is the Medical Bureau for Occupational Diseases. Let's call it the Bureau. It's led by a director who has to be a qualified medical practitioner, and the Bureau handles all the required medical examinations.
And they have real teeth.
They do. The director has significant investigative powers. The right to enter premises, inspect, demand information. They can even require testimony under oath, though standard legal privilege rules still apply, of course.
Okay, so that covers the health side. But this is about compensation, so there must be a serious financial setup too.
Correct. The money side is managed by the Compensation Commissioner. This role is specifically appointed to control and manage the compensation fund, essentially ensuring the system has the money to actually pay out the benefits it promises.
Right, the fund. We'll come back to how that's funded. But first, let's talk about where the regulations really bite. Defining the environment being monitored. We're talking about controlled mines and works. What does it actually mean if a mine gets designated as controlled? What happens then?
Well, first, the designation itself usually gets triggered if what's called risk work is performed by 30 or more people. Or the minister can just declare a place controlled if they think the conditions warranted, even with fewer people.
Okay.
Once it is declared controlled, that mine or works falls under the full weight of the Act's monitoring requirements. That means things like mandatory certificates of fitness for workers doing risk work, periodical medical exams, and, importantly, paying those compulsory levies based on their risk profile.
And who figures out that risk profile?
That's handled by a separate body, again, the risk committee.
Another committee.
Yes. Established specifically to determine the degree of risk for any controlled mine or works. They use a prescribed scale. It's chaired by the chief inspector of mines, includes the director of the medical bureau, and other appointed experts, including at least one other medical practitioner.
And their finding is pretty critical, I imagine.
Absolutely crucial, because their risk assessment directly dictates the financial obligations, those levies that the mine owners have to pay into the compensation fund. Higher risk means higher levies.
Okay. Central to the committee's job, then, is defining risk work. What actually counts as dangerous exposure under this law?
Risk work is defined quite broadly. It's essentially any work declared by the minister after consulting the risk committee where a person is exposed to, well, dust, gases, vapors, or working conditions that are harmful or potentially harmful.
Right.
And here's a really key point, something that shows just how seriously the law takes potential exposure. For calculating compensation eligibility and the levies owners pay, if a person performs risk work for just 15 minutes or more during a shift.
Only 15 minutes.
Yes. That counts legally as a full shift of exposure.
Wow.
Yeah.
That's a very low threshold. It's not just a technicality, is it?
Not at all. It really demonstrates the legislature's intent, likely stemming from, the severe historical problems with dust diseases. It assigns liability based on the potential for harmful exposure during that shift, not necessarily a measured dose over 8 hours. It reflects the seriousness of these specific occupational hazards.
Even minimal time in that risky environment counts as a full liability shift for the owner.
Precisely. It prioritizes the protective principle over, say, a precise measurement of exposure for that single shift. It's a powerful legal safeguard for the worker.
Okay, let's switch gears slightly to the mandatory health checks. If you're going to perform this risk work, you need a certificate of fitness, a C of F. Tell us about that.
That C of F is really the first and most critical gatekeeper for worker health in this context. It's absolutely mandatory for anyone doing risk work. The certificate itself is usually valid for up to 3 years, but, and this is important, the director of the medical bureau can put restrictions on it.
Like what kind of restrictions?
They might limit the worker to a specific job or a specific mine, or even for a shorter period based on the medical findings from their examination.
And it's not just a one-off check at the start.
No, definitely not. To renew the C of F, workers have to undergo periodical medical examinations. The frequency and nature of these are prescribed by the minister.
And who picks up the tab for all this mandatory health screening?
The owner of the controlled mine or works has to cover the entire cost. That's for both their current employees and also for potential employees undergoing pre-employment checks for risk work.
So the burden is squarely on the industry.
Yes, it reinforces that principle. The employer carries the responsibility, the liability for the health impacts of the occupational environment they create.
Okay, now we get to the core question, really. What specific illnesses, what diseases is this act actually designed to compensate for?
Right. The key thing is the disease must be attributable to the risk work performed. And that critical determination is made by yet another specialized body, the certification committee.
Okay, so what's on their list?
The list includes specific, often chronic, and serious conditions. Things like 1. Pneumoconiosis. That's defined in the Act as a permanent lesion of the cardiorespiratory organs caused by inhaling dust. 2. The joint condition of having both pneumoconiosis and tuberculosis, TB, together. 3. Tuberculosis TB on its own. But there are conditions here. It must have been contracted either during risk work or within 12 months after leaving it, and the person needs to have worked at least 200 risk shifts.
200 shifts, okay.
4. Permanent obstruction of the airways. 5. A condition called progressive systemic sclerosis. And finally, there's a catch-all, any other disease that the minister declares compensatable based on medical advice. So the list can potentially expand.
It sounds like quite a complex medical assessment process. We've got the Bureau doing the initial exams, the certification committee making the finding about the disease, and I think the outline mentioned a reviewing authority too.
That's right. That separation of functions is really important for, ensuring due process. The certification committee's job is to determine if the disease is present, its nature, and crucially, the degree of the disease, because that degree dictates the level of compensation awarded.
How does the law define those degrees? Is it clear-cut?
It lays out two main categories for impairment. First degree is defined as having a permanent disability that's assessed as being between 10% and 40%.
Okay, 10 to 40%.
Then second degree is the higher threshold. That applies if the permanent disability is assessed as being more than 40%. Or, importantly, it also applies if the person is found to be suffering from multiple compensatable diseases at the same time.
So having two listed diseases automatically bumps it up.
Well, specifically, the Act notes that if tuberculosis occurs alongside any other compensatable disease, like pneumoconiosis, that automatically triggers the higher second-degree classification. This degree classification is absolutely critical. It drives the whole compensation calculation.
Let's shift then to the money side of things, the financial mechanics. How is this compensation fund actually structured, and how does the money flow in and out?
The Mines and Works Compensation Fund is surprisingly complex internally. It's actually split into 4 distinct accounts.
4 accounts.
Yes. There's the state account, the mines account, the works account, and finally, a research account.
Why split it like that?
Well, this segmentation seems intentional. It allows the system to clearly separate, perhaps, the state's responsibility maybe for historical legacy cases before certain dates from the industry's ongoing financial burden for current exposures linked to mines and works.
Makes sense. And where does the bulk of the money come from, the primary funding?
It comes directly from the industry.
Well,
Owners of controlled mines and works are required to pay levies to the Compensation Commissioner. These payments, these levies, are calculated based directly on 2 things: the risk level of their operation, as determined by that risk committee we talked about,
yeah.
and the total number of risk shifts worked by their employees. There's also that smaller, separate levy. The Act caps it currently at not more than 2 cents per risk shift, which is specifically earmarked for research into occupational health issues.
And we should probably highlight again the owner's direct responsibility for healthcare costs even before the fund pays out benefits.
Oh, absolutely. That's Section 36A. The owner must pay the legitimate and proven cost for medical aid needed because of a compensatable disease right from the moment the disease is diagnosed. It's a direct, immediate liability for the employer, separate from the longer-term compensation payments from the fund.
Okay, now let's get to the actual benefits. Let's focus on the structure used for findings made after that key 1993 amendment date, the one that removed discrimination. I think it's mostly one-sum payments now.
Mostly, yes, for findings post that fixed date.
Instead of specific rand amounts, which change with inflation anyway, can you explain the mechanism for calculating those one-sum benefits?
Sure. The calculation uses a pretty clear algebraic formula. It's A times 12 times B.
Okay, break that down. What's A and what's B?
A represents the person's monthly earnings at the time. However, the law puts a statutory cap, a maximum limit, on this earnings figure, A, used in the calculation.
To keep the fund sustainable, presumably.
Exactly. It ensures the system remains fiscally manageable. Then B is a multiplier, a factor that's tied directly to the degree of the disease certified. So, for example, the factor B used for a first-degree finding is significantly lower than the factor B used for a second-degree finding. This reflects the higher level of permanent impairment in the second degree.
So the system is standardized. You take the worker's capped annual salary, multiply it by a legally set factor based on how severe the disease is found to be.
That's the core mechanism, yes. And the law also ensures there's always a minimum benefit floor amount, so even lower earners are guaranteed to receive a meaningful compensation sum.
And there's a crucial protection for these benefits too, right?
A very important one. This is a core worker guarantee under Sections 130 and 131. Benefits and any service gratuities paid out under this act are protected. That money is sacrosanct, essentially. It's explicitly shielded from attachment if someone tries to execute a court judgment against the worker. The only exception is if the commissioner needs to recover funds, and, just as importantly, these benefits are free from any form of income tax.
That's significant. Okay, so let's try and pull this all together. We've looked at a highly specialized compensation system. It manages risk through this complex network of administrative bodies. the Medical Bureau, the Risk Committee, the Certification Committee, and it tries to ensure financial protection through these levies paid by industry into dedicated funds and by legally protecting the benefits paid out.
Exactly. The whole system is designed as a comprehensive regulatory ecosystem. It's specifically tailored to the unique, often long latency risks associated with mining diseases. Its sheer longevity and the fact it's been amended so often shows this constant effort to adapt, particularly as we discuss that profound move away from the old discriminatory structures towards universal compensation based purely on medical fact and exposure.
Now, as we wrap up, we should touch on something looming on the horizon. Our source material indicates there are some uncommenced amendments linked to the newer National Health Insurance Act, the NHI Act from 2023. These changes apparently suggest substituting sections dealing with medical costs and potentially deleting the owner's current direct responsibility for immediate medical aid under Section 36A.
Yes, and this raises a really important question both for you, the listener, to think about and for the future of this specialized compensation regime. The question is, how will that primary responsibility for immediate medical care, currently sitting partly with the employer under the ODMW Act, how will that shift or perhaps be shared once the broader NHI framework is fully up and running?
Will the industry's direct liability for those initial health costs transfer entirely to the state-run NHI system?
Or will these specialized compensation funds, funded by industry levies, perhaps retain some primary obligation for the medical costs directly linked to the compensatable diseases they cover? It's unclear how that interface will work in practice.
It's certainly a compelling dynamic to watch. It highlights that complex intersection between very specific labor laws like the ODMW Act and much broader public health policy as these systems evolve and inevitably overlap. Definitely something to keep an eye on. Thank you for joining us for this deep dive.